This is Radio Health Journal. I'm Nancy Benson. This week, a major reason babies grow up to have allergies.
You hope that the good gut bacteria outweighs the bad gut bacteria. But when that doesn't happen and there's more bad gut bacteria, it changes everything.
Achieving a bacterial balance when Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This is Sean Waldron, production director for Viewpoints. I'm usually behind the board instead of behind the mic, but this week I'm here to give you a preview of what's coming up next on Viewpoints. The two segments are polar opposites, but fascinating in different ways. Up first, a show about domestic violence, which is more prevalent than you may realize.
The Center for Disease Control cites that 1 in 3 females and 1 in 4 males will be the victim of some type of physical aggression by an intimate partner over their lifetime.
That was Dr. Shannon Carl from Nova Southeastern University. Dr. Jay Richards, a forensic psychologist and author of the novel Silhouette of Virtue, also joins the show. We change gears in segment 2, where former Jeopardy champ Ken Jennings talks about the evolution of comedy in society.
It's going to be hard to imagine nowadays, but ads did not used to be funny. Like, ad agencies were terrified of humor because they thought that audiences would remember the punchline but forget the product.
Jennings also talks about the impact of comedy on politics and the role social media has played in spreading comedy to areas of society where it has not lived in the past. Listen to those great shows this week on your favorite radio station, or you can listen anytime on our website or by subscribing on iTunes, Stitcher, or wherever you listen to podcasts.
Children in the United States are a lot more likely to develop allergies than they were a few decades ago. In fact, some experts say they're 5 times more at risk of allergies and asthma than their grandparents were. Reasons behind it have focused on what's called the Hygiene Hypothesis, the theory that kids grow up in too sterile an environment today, so their immune systems never get exposed to common allergens. But new research is showing that something else is also at work in our intestines.
Scientists at UC Davis have been studying the infant gut microbiome. That means they've been looking at baby poop, which as a pediatrician I love, and they have found differences over the last 100 years.
That's Dr. Tanya Altman, assistant clinical professor of pediatrics at the UCLA Mattel Children's Hospital and editor-in-chief of the American Academy of Pediatrics Parenting book series.
There's this generational decline in the B. infantis, which is the good gut bacteria that babies usually get during the birthing process from mom. But due to medical interventions such as antibiotics and C-sections, we know that 9 out of 10 babies no longer get the transfer of this good gut bacteria that they need. Because when you don't have the B. infantis, when babies are born and young, you get an overgrowth of the bad gut bacteria. And it's this overgrowth of bad gut bacteria that is linked to more cases of allergies and asthma and obesity and other diseases later on in life.
Research shows that it's especially critical to have a good balance of bacteria in the gut during the first year of life. A process called vaginal seeding can give babies born by C-section the bacteria from their mothers that they'd normally get during the birthing process, but it's not yet widely practiced. Other modern conveniences and medical practices can also throw the bacterial balance off. In fact, some things a woman's mother experienced can end up affecting her own baby.
Maybe your mom had a C-section, or maybe your grandma didn't breastfeed, since the breast milk also helps feed this good gut bacteria. Or maybe you took antibiotics during your pregnancy because you had a sinus infection. So there's a lot of things, that we do now which are great medical interventions and save lives, but that also sort of disrupt our own gut microbiome and decrease that good gut bacteria that we don't have to pass on to babies. So let's say that a new mom does everything right. They don't take antibiotics when they're pregnant, and they have a, vaginal delivery, and they poop on the table, and they breastfeed their baby. They still might not have had that good gut bacteria to pass on to their baby.
Many people believe that breastfeeding can overcome all of this, but Altman says it's not a cure-all if the wrong conditions are already established.
Breast milk really is the best nutrition for babies. But what's interesting is because babies don't have the same gut microbiome as they did generations ago, they actually are no longer able to utilize all of the important nutrition in breast milk. So the babies in this study, when we supplement them with Avivo every day, which is a powder probiotic for babies, it's the B. infantis, you can mix it with breast milk and feed it to your baby every day, we actually found that babies were able to utilize all the important nutrition in breast milk. They weren't pooping out 15% of the, good special carbohydrates that the probiotics feed on, and that they decreased their chance of bad bacterial overgrowth by 80%. It is the breast milk that's important, but you also have to have the good gut microbiome to be able to utilize and absorb all of that liquid gold.
Doctors are finding that the gut bacteria are responsible for much more of our body's workings than we realized. The wrong mix can mean the difference between being thin or obese. Our gut bacteria even send signals to the brain, so it's no stretch to think they may be responsible for lifelong allergies.
The microbiome is sort of this balance. I mean, you have good gut bacteria and you have bad gut bacteria, and you hope that the good gut bacteria outweighs the bad gut bacteria. But when that doesn't happen and there's more bad gut bacteria, it changes everything, and it actually can cause more inflammation in your body. When you have that as a baby, it reprograms your immune system differently. And so we know that older kids that have asthma and allergies have higher levels of this bad gut bacteria. So it's sort of this, healthy balance that you want to keep throughout your life. So you can set the stage after birth by, feeding your baby B. infantis, by breastfeeding. But then when your kids get older, you want to make sure that they're also healthy, that they're eating a high-fiber diet. They're getting plenty of fresh fruits and vegetables, whole grains, beans, legumes, because this is also what feeds that good, healthy gut microbiome and promotes, a healthy, diverse bacteria gut microbiome in your gut as you get older.
Right now, Altman says there's no way for parents to know whether kids have a good or bad mix of bacteria. In the future, that should be possible. But if we know from studies that 9 out of 10 have a less than optimum mix, she says thinking about taking probiotics makes sense, especially when the bacteria have been subject to an upset.
The first 6 months of life are really the most important for setting the stage with a healthy, good gut microbiome to help protect your baby and child for life. But you're right, at any point in life, you can take a course of antibiotics, and that could wipe out a lot of the good gut bacteria that you need. So if initially you have that proper environment with all the right things going on, it's going to be easier for you to recolonize your body with the good gut bacteria. But yes, that's why, most doctors, when they do put older kids and adults on antibiotics, they will say, let's start you on a probiotic. Let's continue that probiotic for a few weeks or a few months once you finish the antibiotics, just to help get things back on track.
But even when you haven't been on an antibiotic, Altman says it's a good bet that mom and dad don't have the perfect microbiome either.
There's a lot of new research and data coming out for adults and the benefits of probiotics. We're learning which bacteria are most beneficial at different ages. So I would say, stay tuned. But pretty much at any age, I recommend various probiotics for my patients, and I take them every day myself because, we can all use a little bit more help with the good gut microbiome. And also, with a healthy diet and good nutrition. I think in the U.S. now, their diets are too overly processed, and they're not getting enough whole, real high-fiber foods. And that's also what you need so the good gut bacteria can thrive.
You can find out more about all our guests on our website, radiohealthjournal.net. You'll find archives of our shows there, as well as on iTunes and Stitcher. Our production director is Sean Waldron. I'm Nancy Benson.
Medical notes this week. Experts have proposed new guidelines for hypertension, and if they go into effect, it's much more likely your doctor will tell you you've got high blood pressure. The guidelines define high blood pressure as anything higher than 130/80, and a study in the journal JAMA Cardiology finds that nearly half of all adults are higher than that. More than 83 million Americans would be recommended for high blood pressure treatment under the new system. In youth league and high school baseball, most pitchers also play another position when they're not on the mound. But a study in the Journal of Athletic Training argues that it shouldn't be catcher. The study finds that pitchers who also play catcher are nearly 3 times more likely to get hurt than pitchers who play any other position on the field. Among position players, catchers throw the ball more than anyone else, and throwing adds up to far more arm injuries. And finally, if you want to have a good business meeting, serve coffee. A study in the Journal of Psychopharmacology shows that small groups who have coffee together before a meeting rate their own performance and the results of the discussion more highly than those who did not have coffee. Apparently, caffeine gets the credit. Rerunning the experiment with decaf didn't provide the same results. And that's Medical Notes this week. More in a moment.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.